I tried out. But I had to go to the court. I got to the court. Yeah, I'm like, and like my friend, like, I'm so sad. We're gonna take a bike to like the court. Yeah, like over 20 miles per hour. I was like, yeah, I was actually driving. And so I had to go to the court. He was like, having me out of it. Yeah, it was so. I was never better. Yeah. There was just a lot of I just got a warning. But it was state trooper and then yeah, and I just got I thought get out was half an hour.
Is it just you too?
Yeah.
Okay, awesome. And feel free to take another minute if you need it. I know you're counting and I'm interrupting.
Good. Luckily, I've been counting my whole life, so I should have it down by now.
You should. Right. Cool.
Yeah, I don't know. Yeah, me too.
We actually do one.
Yeah, but it's
So
sugar,
excited.
so
Yeah, so
hopefully
obviously-
there's not going to be any fentanyl or anything
If
in
so,
it.
you might be calling equal.
Maybe,
Like, what's going
yeah.
on? Okay.
It would be kind of concerning.
I'm ready when you're ready. Are you ready?
Yeah, of course I'm ready.
Okay, wonderful. Hi, everyone. How we doing? Yeah? Feeling good? Okay. Well, I'm really excited today to have a guest speaker at the beginning of class. As you can see, she's set up well. Lots of things are going, so she'll introduce herself. But so just to give you an idea of how class will go, we'll have about a 20 to 25 minute presentation that will train you all to administer what's called Narcan and use fentanyl test strips. Which is overdose prevention and response, which we'll learn a lot more about. Obviously, this is something that you all know that I study, but I just happened to run into their organization on campus, which started in 2025. And so I think that's super exciting and thought, given this is a health campaigns course, you can really learn about something like very applied, like how do you use health communication in the real world. So if you could, for the first 20 to 30 minutes, put your technology away and give full attention because you're going to get trained on Narcan, you will have the remainder of class to work on your presentation. And it shouldn't take more than 20 to 30 minutes at the beginning. Okay. All right. So please give a round of applause for our guest speaker from End Overdose.
Hey, perfect. Thank you so much. My name is Nini. I'm the president of End Overdose here in Auburn. If y'all can take a couple minutes to take our pre-survey and our waiver really quick. It helps us a lot with our logistics and our stats. And whenever y'all are finished, just put your phone down and look up so I can know you're done. Okay, that's totally fine. How about the waiver? Is it still like that as well?
Yeah.
Okay, yeah, it's fine.
Oh my gosh, Albie, sorry.
Oh my gosh.
You can see here. Can you come in?
Yeah, he's trying to come in.
No. Tell him to come in. Wait, everyone's coming.
Here, I'll let him in.
Hey!
Overdose training off.
That's crazy. Oh, it's gonna take 20 to 25 minutes if that's okay. All right, well, perfect. Okay, well, perfect. Assuming all of y'all are finished, I'm just gonna go ahead and get started. We want to value Abby's time over here. So just a couple of disclaimers. This training is in no way substitute or for medical attention or an event of an overdose. It is for educational purposes only. And overdose and drug use are going to be discussed throughout the presentation. So just a couple of things to keep in mind as we go along. Couple of our objectives for today, the understanding the opioid overdose epidemic, defining opioids, including fentanyl, describing their physiological effects and associated risks, understanding the use of fentanyl test strips, understanding the Good Samaritan law, recognizing the signs and symptoms of an opioid overdose, as well as knowing how to effectively respond to an opioid overdose, including administering Loxolone, providing rescue breaths, and then also the recovery position. All right, a little bit about us. So we're a nonprofit, 501c3 based in Los Angeles with over 50 chapters across the nation. We work to end drug-related overdose through education, medical intervention, and public awareness. Thank you so much. All right, and then a little bit about our chapter here at Auburn, which was founded in 2025. And to this day, we've trained 708 individuals, distributed upwards of 1,124 doses of naloxone, as well as 238 fentanyl test strips. What we do is we equip individuals across the country with preventative measures such as fentanyl test strips, as well as responsive measures like naloxone to combat opioid overdoses. And this is to educate and train individuals on how and when to intervene during a suspected opioid overdose. All right, and we do this because there are over 100,000 deaths each year related to overdoses, and 40% of these deaths have reported somebody present who might have been able to intervene and reverse the overdose if they had known how and when to respond. All right, so a little bit about opioids. So we have a list of opioids over here. Essentially, they will bind to the opioid receptors in your brain. They'll cause pain relief and pleasurable effects, and then also control pain, breathing, and stress. Out of all of these opioids, we're going to focus on fentanyl today the most. That one's the super important one. So fentanyl is an opioid painkiller that is often mixed with other drugs. It is cheap, it is 50 times stronger than heroin, and it is 50 to 100 times stronger than morphine. Fentanyl is used in medical settings, but right now, currently to the overdose trends, it's often illegally manufactured. It's mixed with a lot of other drugs, so it'll increase the risk of addiction and death. All right, so basically the amount of fentanyl it takes for somebody to overdose will depend on what type of fentanyl you're taking, the analog, your personal tolerance, and also how it's ingested. So if you look at the reference chart down here, that is equal doses of each drug. So that dose of morphine is equal to that small dose of fentanyl, and also is equal to that smaller dose of carfentanil. So carfentanil is the fentanyl analog that is 100 times more potent than fentanyl. So that one is the one that you really want to look out for. It's super, super dangerous. Okay, and so how you can prevent an opioid overdose is by using fentanyl test strips. If you are using, or if anybody you know is using, you would like to use this to detect very small amounts of fentanyl, for example, carfentanil, like we talked about. It can be used on any drug that dissolves in water and is associated with slower and more careful use. So how you use these test strips, I'll demonstrate here in a bit. So first you'll fill a container with water. This can be either a shot glass, a bag, or a testing strip package. For most substances, you want to use like a half teaspoon of water, but if you're testing methamphetamines, MDMA, ecstasy, you want to use a full teaspoon for every 10 milligrams. So you'll dissolve a small amount of 10 milligrams in that bag, and then you will add a half teaspoon of water. So here, I'm going to demonstrate for y'all real quick. So here's going to be a testing strip. And if y'all don't remember this, that's completely okay. All of the information is going to be on the back if you forget. So first you take this out of the bag. And each of these packages is going to come with a testing strip as well as a mini scoop. So you'll take your mini scoop, and here I have sugar. As you can see, it is completely sealed and should not test as positive, but we're going to take this mini scoop and get that equal amount of sugar in there. All right, and then put it in the bag, and then see how my Stanley does in pouring water, but tiny bit. Okay, are you going to use this scoop to just kind of like mix it up real quick? And then next, what you want to do is you take your strip. There's going to be a wavy side, and then there's going to be a blue side. So you're going to hold the wavy end of the stick in the substance. So just hold it in there for like 15 seconds. So I'll just count 15 seconds as I explain this next part. So after you wait 15 seconds, you're going to wait 2 to 5 minutes. This works kind of like a different opposite than a pregnancy test. So if you see one line, it's positive, and you see 2 lines, it's negative. This should be sugar, so it should be negative. I'm hoping it doesn't turn out positive. If it turns out positive, I have to take it up with Equal, the company that, let's not have that happen. All right. So I'll explain the chocolate chip cookie effect for a little bit. So basically what that is if you bite into a chocolate chip cookie, oftentimes you'll get more chips, and then other times you'll get less chips. So this is how that works for fentanyl as well. If you get like a sample, sometimes there's more fentanyl present in it, sometimes there's less fentanyl present. So how you can reduce the effect, you can test more of the substance at a time, and then you can also get even sample by mixing it up and then taking the sample after that. Couple things to consider. So fentanyl can be mixed into drugs without the user knowing. If you take any substance that doesn't come directly from your pharmacy or directly from a prescription, we strongly encourage testing just to make sure it's not laced with anything else. When testing pills, we encourage testing every single pill. And then false positives and false negatives are possible, so test more than once or test another sample if you feel like you need to. Okay, now we're moving on to opioid overdoses. So what is an opioid overdose? This is when too many opioids or a combination of opioids and other substances that you're taking, it's ingested, it goes into your body, it causes ineffective breathing, respiratory depression, and this results in not enough oxygen being delivered to your brain. So if you go 4 minutes without enough oxygen going to your brain, this causes permanent brain damage. You can't get this back. And then it's also soon followed by death if you do not respond fast enough. Okay, so opioids like fentanyl, this works by binding to those opioid receptors in your brain. And once they're bound, they will slow your breathing. They'll affect feelings and sensations as well. How you can combat this is by using an antagonist such as naloxone. This will kick those opioids off of the receptors in your brain, and it'll bind to those receptors and prevent those fentanyl molecules from bonding to your receptors. All right, and so naloxone stays on the receptors for 30 to 90 minutes. It'll give a chance to return to normal breathing and awareness. However, after those 30, 90 minutes, it can wear off. So you can save a life by carrying naloxone. So here I have a whole bunch of naloxone. You might have heard of it as Narcan by the brand name. It's a medication that reverses opioid overdoses. It can restore breathing within 2 to 3 minutes. And if you don't see any effects within 2 or 3 minutes, you can go ahead and administer another dose in the other nostril if the breathing does not restore. And then naloxone also has no risk of misuse or abuse and has no life-threatening side effects. So if you do administer naloxone accidentally to somebody who isn't going through an opioid overdose, they're not going to die. Okay, so there's a couple of different formulations and routes of administration for naloxone. The most important and most common one is going to be in a nasal spray. So you have Narcan, which is the brand name, Patagus, which is the generic. Both of these are going to come in 4 milligrams. Cloxato is going to come in 8 milligrams, but that's not seen as often as Narcan. And then you also have the intramuscular and intravenous injections, but we don't deal with that as often because that's used more for EMTs in hospitals. Okay, so I'll tell you how to respond to opioid overdose. So the very first thing is recognizing the signs and the symptoms. And this is easily remembered by the opioid overdose triad. So difficulty breathing, pinpoint pupils, and unresponsiveness. So you can test for pinpoint pupils. If somebody is kind of knocked out, if their eyes are closed, you can open their eye up. You can use a flashlight. You can use your phone flashlight. That works fine as well. Just shine it into their eyes and then remove it. If there's excessive constriction and their pupils do not respond to light, then they are exhibiting constricted pupils. And then for breathing and pulse, a normal adult will breathe 12 to 20 times per minute, or 3 to 5 times per 15 seconds. So if the breathing is slow or stopped, you see their chest rise and fall, or you don't feel anything coming out of their nostrils, they're probably exhibiting respiratory depression. And then for unconsciousness, usually somebody who is asleep will wake up if you shake them awake. So you can shake them, shout their name, perform some type of painful stimuli like a trapezius pinch them on their back, or ball your knuckle into a fist and then rub on their sternum. It's called a sternum rub. If they do not respond to any painful stimuli or shouting their name, then they're probably unconscious. Okay, and the second thing, once you see all these 3 signs or even one, you want to call 911 and yell for help. Naloxone will last for only 30 to 90 minutes like we discussed before. So regardless on if you do administer naloxone or you don't, they are going to need help. If you do administer naloxone, they might go through relapse after those 30 to 90 minutes. If you don't, then they might be going through something else like dehydration, so they might need fluids, IVs, so you do want to make sure that they get aftercare and paramedics showing up. Okay, and a lot of people, when they are dealing with overdoses or somebody who is at risk of dying, they are concerned about the legal repercussions of this. So this is where the Good Samaritan law comes in. So I'm just going to read this real quick and then kind of explain it in layman's terms for y'all. So a person is immune from arrest and prosecution for an offense if the person reports an emergency drug or alcohol overdose event, and if the person aids or seeks aid for the person who suffered the emergency drug or alcohol overdose, the person remains at the scene of the event until a law enforcement officer or an emergency medical responder arrives. Basically, what this means is if you are acting in good faith, you will not be held responsible for the person or any kind of drug or drug paraphernalia that's seen on you. So unlawful possession or use of a controlled substance, possession of drug paraphernalia, illegal possession or consumption of alcohol or marijuana by an underage person, and then unlawful distribution under 4 grams, excluding fentanyl, and a little bit more. And a lot of the exceptions vary by state. Okay, so after you've recognized these signs and symptoms, after you've called the police, had them come in, you want to administer naloxone to restore your breathing. And I'll explain how to do that here in a bit. Okay, so the very first thing, you want to lay the person on their back, and then you want to tilt their chin up, peel back the packaging on the naloxone, and then this is how you hold it. So 2 fingers up top and the thumb on the plunger, just like a Flonase, and then you place the spray all the way up 1 nostril, and then you push the plunger in all the way, just like a syringe. And then every single dose of this that you administer is going to be a single-use dose. You cannot reuse it, so just throw it away. If you do not see any improvements to their breathing or to their consciousness within 2 to 3 minutes, you can go ahead and administer another one in the other nostril. And if you can't get access to that nostril for whatsoever reason, you can go ahead and reuse that same nostril that you used before. Okay, and the very last thing would be continuing care. So if the person restores breathing, you can use the recovery position. They might start vomiting, and so you want to kind of use that recovery position to have them not choke up on themselves. It's kind of hard to verbally explain, so I have a picture up there for y'all. And then the other scenario is if they do not continue breathing, you're going to want to start rescue breaths. So basically, once every 5 seconds is good to mimic normal human breathing. Usually people carry a mask with them. If you do not have a mask with you, that is totally fine. You can form a seal with your hands and then do that as well. And the main part here is the fentanyl is blocking your ability to breathe. And that's the main thing that's causing the brain damage, the death, and everything. So that's the main thing you want to target here. Okay, so a couple of recap points. So if you notice any kind of dilated normal pupils that are responding to light, if you notice normal breathing, if you notice a response to stimulation or speaking, it might not be an opioid overdose and you do not have to administer naloxone. But however, if you do go ahead and administer naloxone, again, there is no legal repercussions or the person is not going to die. And then naloxone only works for opioid overdoses. So if this is like a cocaine overdose, if this is alcohol poisoning, it's not going to help them. Okay, and then another thing, of course, is to call 911, have the paramedics come momentarily. A couple more things to reconsider. Ensure the person overdosing gets to the hospital immediately. Again, they can relapse after those 30-90 minutes when the naloxone wears off. So that is super, super important when it comes to responding to that opioid overdose. Naloxone has virtually no effect on someone who is not overdosing. Naloxone can cause withdrawal symptoms, which can make a person nauseous, irritable, and or cause cramps. And due to the withdrawal, a person given naloxone may want to take more drugs. Do not let them. That is very imperative. A lot of people, when they are withdrawing, when they start waking up, they can be irritable. So just kind of let them have their space, stand back for a bit, make sure they're in the recovery position so they don't choke up on themselves. But do not by any means let them take more drugs because you don't want them to go through that again. Okay, perfect. And that basically ends our training for today. If y'all want to take the post-training survey, I'm not sure if that QR code works, but if it does work, go ahead and take that. I do have a couple of doses up here for y'all. I think I brought one for each person, so that's totally fine. I also brought fentanyl test strips if y'all do want to take one as well. And then when y'all do take those, if y'all want to take a certification card, I really think that those look cool. Again, my name's Nini, so if you write my name on the very bottom and then the date and then you sign your name, if you see us on any other campus organization or if you see us around, you can go ahead and show that card to us saying that you have completed your training and we'll give you another dose at no cost. I don't know if y'all know, but in Walmart, 2 doses of naloxone is like $40, $50. That's really expensive, but we give it out for free. So that's a really great resource to have. Okay. Let's just talk a little bit about our club at Auburn before we finish. So these are some of the events that we have done. We do a lot of music events and music festivals. You can see me in some of these. I got to meet Shaq, who's on the very top right, and that was really fun because I'm 4'11", he's very much not 4'11", so it was kind of intimidating for sure. But it's fun to get to train a lot of people, get to meet new people during those events, and that's really fun. And if y'all do want to volunteer or join our organization, I have that QR code down there for y'all, as well as our Instagram and our mail. Right? Perfect. Have any questions? Or y'all good?
What questions do you have?
Okay, well, perfect. If y'all have any questions, thank you for your time.
Can I
Yeah.
ask a couple questions? Could you step over here and show them the sternal rub?
The sternal rub, yeah. So basically just like this. So this part of your knuckle is super hard. So it's going to hurt when you hit your sternum. So it's going to be in between your ribs right here, kind of like where your heart's right here. So it's going to be right here. So just rub. If you want to do that on yourself, it's going to hurt. So just press down super hard using this part of your knuckles on your sternum. It's going to hurt. And so if you're unconscious or sleeping for any reason, you're probably going to wake up. And if they're unresponsive to that, they're probably going through an overdose. Anything else?
If you do administer it and someone was not overdosing on opioids, like should you still get them to a hospital or are they?
Well, it just kind of depends on, you do want to get at least medical staff over. If they're fainting, probably maybe a stroke, heart attack, it could be something like that. You do want to get them medical help. But if they're just a little bit tired or they just want to sleep, they probably just need water, electrolytes.
So I was trained in this. I'm an RA, so we have
Yeah.
first response training. But I know for other like people who are unconscious, if you find them and you don't know if you hit their head, you're not supposed to move them.
Yeah.
So how would you advise administering Narcan if you're unaware of a potential head injury?
Well, usually if they're already laying on their back, that's a perfect position to already administer their naloxone. I wouldn't exactly recommend doing naloxone immediately, especially if you see them breathing or if you call their name or like, hey, wake up, and they respond. I would test for those signs and symptoms first. If you see all 3, then you can go ahead and administer naloxone, but you don't want to automatically, if you see somebody laying on the floor, assume that it's a overdose, if that makes sense.
And then I don't know if this was you guys or another organization, but can you talk about the stations around campus?
It wasn't us, but I think it's SGA. They are talking about putting at least 1 dose per station.
They're already up.
Oh, okay,
Yeah.
okay, perfect. Do you know if they have like any instructions or anything?
I think they come in the big box, like with
Okay.
the 2 doses that has the instructions on the
Yeah.
back.
So I heard a little bit about that. That wasn't us though, so I don't
Yeah.
know too much about that.
But they're on. I think there's a map. I think there's a map like online that you can find, but it's on the like 911, the blue light
Mhm.
boxes around campus. They installed naloxone, and also in the AED machines they have.
Okay, perfect. And if they don't have any kind of instructions on how to use them, you can go to our website. We have a lot of instructions there. And then if you want to go to any of our meetings, we can go ahead and retrain you. It's no problem. Yes.
If you need to administer mouth to mouth, I don't know what you like called it on there, I can't remember, but
Yeah.
if they are overdosing and they took the drug by their mouth, could that not come in contact with you and then you? That could be a really dumb question.
No, it's not. It's not at all. If you don't feel comfortable, so that's where the mask comes in. A lot of people like to have like a respiratory mask that they can put on them to reduce that kind of contact. If you don't feel comfortable, obviously don't do it. That's why it's really important to have paramedics come and deal with that for you.
And what does the hand seal look like that you described?
So it'll be closing their nose and then making sure their head stays tilted up, closing their nose, and then breathing into their mouth, basically. Just to make sure the air doesn't come out the nostril. Yes.
Doesn't the Good Samaritan law also apply if you have to perform CPR?
I'm not quite sure about that. I just know that in the sense of opioid overdose response, but I think so as well. But don't take my word on it. Right, anything else?
Thank you so
Okay,
much.
perfect. Thank you all. Appreciate it.
Thank you so much. And if you all want to go ahead and get your materials, that way you don't get them at the end of class. Please feel free to do so.
Yes.
Yeah.
Yes.
I have one other question.
Yeah, of course.
It's like pills you test every cell. How would you do that if you like you can just rush the pill up, give a tablet. Yeah, and then you put like I guess like do you recommend testing all of them? Like how would you get someone to give all of the pills? You wouldn't. This is for yourself if you're using them. If it's somebody else, then that's their responsibility.
One the best if they're willing to take half of one even, right? Like it's sort of like what are they
In the sense of use for drugs that can dissolve in water, if the drug is not dissolved in water, it's not. Yeah.
Wonderful. Thank you so much.
Thank you.
This
Look
was
at the
fantastic.
test. It's almost so positive.
Oh no! Why
Yeah,
would it
'cause-
do that?
Oh, well, sometimes there's false.
Yeah.
Yeah, of course.
It expires in February. Like, does that?
Yes, so usually it's about 2 years after it's made, the expiration date. However, research shows that it can be up to decades before it actually expires. The FDA just requires an expiration date on there, but it should be effective for a really long time. It's a super stable drug.
That's awesome.
Yeah, of course.
Fantastic.
Okay, wonderful.
Thank you so much for
filling.
coming. Yeah.
Yes.
Say your name.
An INI. It's a great, yeah.
I might have you all come back in the fall and teaching the
Of
same
course,
class.
yeah,
Would
we'd
that be
love to.
great? Okay, would love to just do that.
I'll still be here. I'm a senior, but I'll still be here.
Okay, good. Fantastic.
I'm gonna wait for a bit just to make sure if anybody wants to grab some more stuff, and then I'll pack up.
Okay, perfect.
Did you still have material after this?
Yeah.
Okay.
Yeah.
Yeah, I'm gonna wait maybe like.
Yeah, you can hang tight. Yeah, you can hang tight. No worries.
Yeah.
No worries. And are these slides I can post on Canvas, or I didn't make them like I'm fine with not posting them because they're probably your organization.
Yeah. So headquarters says that we can't post it, but I can make like an infomercial thing.
No, you're good. I basically just put it on there and hit it because I wanted to pull it up for you. So
Okay.
Not a problem at all.
No, you're so good.
Okay, but that's why I wanted to ask. Yes, perfect. All right, folks. So the rest of this time is to work on your presentations, your portfolio. Just real briefly, I do want to go over the portfolio because we haven't talked about